This 11-year-old dental phobic patient was referred to me for endodontic treatment of tooth number 19. As you can see, large, very big cavity or decay into the pulp, and she had all the signs and symptoms of irreversible pulpitis. So her parents taken her to her dentist, and her dentist told them he couldn't do anything. His tooth was not easy. It was not an easy root canal. Besides, she needed to be sedated, so she was referred to us for sedation and endodontic treatment. And that's what we just did today, just now. I completed this case just now, so let's take a look at it. As I said, decaying to the pulp, so the first thing that we did was, of course, rubber dam. Good profound anesthesia. We make sure of that. And besides, patient is sedated, so she gets all kinds of goodies through the IV, but cleaned out the decay. The mesial and lingual walls were lost due to decay, so we rebuilt those. I use composite. We rebuilt those, and take a look at the post-op. And here's the post-op. So take a look. As I said, she is 11 years old. So these young teeth, they have anatomy like this. So take a look here. 4 mesial canals, 1, 2, 3, 4, and 3 distal canals. And look at all of this webbing and anastomosis between the canals, the distal canals here. Look at all of that. So the only way to clean these nooks and crannies is, of course, full strength 6% sodium hypochlorite that we use copiously, regardless of the age of the patient, or regardless of if we have an open apex or not. It doesn't matter. 6% sodium hypochlorite is the irrigant of choice. So we use that, plus in this case I use sonic activation. With sonic activation and 6% sodium hypochlorite, you get all of these spaces cleaned. Remove all the pulp tissue from within these spaces. Then you can go in and 3-dimensionally obturate. And when you 3-dimensionally irrigate, instrument shape, irrigate, activate, and obturate, this is what you get. As you can see, everything went beautifully. We went ahead and temporized the tooth, and parents will take her back to her dentist for the permanent restoration. And sedation went very well also. IV sedation. She took a nice nap. And this took me about 45 minutes to do.